On this episode, Ryan joins me in Mesa, Arizona. We discuss Judgy dentists, way too much about root canals, and our orthopedic surgeons, even doctors.
You'll have to wait to find out.
Welcome to The Dentist Show. Let's jump right in.
Welcome to The Dentist Show.
The Dentist Show.
We are in Mesa, Arizona,
Yeah, brought to you live from Mesa.
and Ryan's back.
Yeah,
We're together again.
I was missing Chase so much that I flew down just to record podcasts.
Yeah, he flew down just to do this, just for our audience's pleasure.
Yeah, yeah.
He's like, the live is way better.
Yeah,
So here
live
we are.
is better. Actually, I wonder if it is better.
Yeah.
And
I don't know. We'll have to ask the audience someday.
yeah. Did you like our videos when we're separate or when we're together?
They're like, we like when it's off.
I thought you guys were canceled by now.
I thought you guys were all done and hung up
No.
and you moved on and just drilled teeth again.
No, we're going at this hard. We're going to...
1,000 episodes until
Yeah.
I think Howard Ferran's at like 1,500 and then that's when he stopped. So
Oh, really? So that's the number we got to
I guess
beat?
that's the number.
1501.
I bet Howard will come on our podcast. We'll have to ask him.
Yeah.
He's a funny guy.
Yeah.
He's super fun and so controversial. He'd be fun to like poke the bear a little bit.
Yeah.
Because he
See
has
what he
some
says.
he says a lot and a lot of it's off the cuff. So
Yeah.
it'd be fun. I remember going to a course, an endodontic course at Spears, and the endodontist there was not a Howard fan, and he told me, I was like, why? Like, tell me more, you know? And
Yeah, what is
'cause
it about him?
like everyone likes Howard or doesn't like him. And
Yeah.
he said he wrote an article years ago about new dentists
Yeah.
and how they can get better. And the concept, I understand what he's saying, and maybe the delivery was wrong.
Yeah.
And Howard said, you new dentists need to go try some things. And so go do that second molar root canal.
Yeah.
Worst case scenario, you get to take it out and then you get to do an implant.
So it's like planting seeds
He's planting seeds.
and watching them grow.
The endodontist was so upset. I was
Yeah.
like, I don't think that's not what he meant.
Yeah.
And he just means like it's gonna be okay. Like,
Yeah. I think you and I probably see things very similar that way. It's like, okay, don't go into something that you're not confident you can
Right.
do well at. And when you're in there, do your best.
Yeah.
And if the worst case scenario happens, be a good person and take care of the patient.
Yeah. Just take the tooth out.
Yeah.
I think Howard said like the patient will never know or something like that, and that's what really bothered him. I was like, yeah, but the patient won't know.
Yeah, but truth is, it's like a mechanic. The patient doesn't know what you're doing in there, and that's actually why I think, to a certain extent, it's hard to trust your medical providers in general because you don't know.
I mean, I've never had trust issue with doctors, but
yeah.
mechanics, yeah, or car salesmen, yeah. But
Especially those used car salesmen.
yeah,
I'm just,
but the medical professional, I've never had a problem with, and
Yeah.
I don't think majority of patients do second guess us. They sometimes will say like, "Oh, it's not hurting, so I'm not fixing it."
yeah,
They're not saying they don't have a problem. They're just saying, well, "I'll just wait till it hurts."
Right.
But that's that. I think dentists can be a little more like what Howard's saying is like, go and try things in practice. That's why it's
well, they call it practice.
Yeah, and then you can, if something happens, we have these great specialists that can bail us out, and maybe don't make too big of a mess where you have to take out the tooth. Because most of the time, if the endo's going wrong, you just refer it to the endodontist to
Right.
fix for you. And if you work with some great endodontists, when I was learning, I had some great ones that just said, "Oh yeah, this happens to everybody, to my patients. You know, this
Yeah.
happens to me sometimes," and they bail you out. They're not going to throw you under the bus because they want your referrals.
Right.
And they're actually, I think most of the time they're like, "Hey, at least he sent it to me," versus trying to finish it and saying, it'll work. So,
Yeah. You finish a sketchy endo where you perfed it 3 times and then finish it and then seal it up and be like, all right, you're good to go.
yeah. Have you ever perfed a root canal?
Oh yeah.
Oh, you came out a little fast there.
Yeah.
Like how
Well,
many are we talking?
It's because
Last
two
week.
two that I can remember.
It's funny that we always remember those.
Yeah, mine was, so it was kind of a wild story. It was actually in our Chandler office. And
What? That was what?
yeah, wait for the lawsuit to come.
Right.
No,
This
no.
is why we don't hire new grads.
Yeah, so I think like 20-year-old female. I'm going into, I think, I can't remember if it was left or right. So it's number 4 and number 5, or number 5 or number 12. Okay. And it's had a crown done, and I'm going through the crown. I get in there. I don't know what's left or right at this point. I'm lost in there, and I perf out the buckle.
Nah, you found it.
Yeah.
You're like, blood.
Yeah. I found it. So I perfed out the buckle just under the crown margin, and that time, at that point, I'm like, man, I'm the worst dentist ever. I've just like ruined this girl's tooth for the rest of her life.
Yeah.
And then same day, actually, this is pretty funny. Dr. Saunders, he's like, you're not the worst dentist. I just cemented a crown on backwards. The same day, he's just in there like shaking his head. And I'm like, well, did you cut it off? He's like, no, patient said it's fine.
Oh boy, I'm sure I replaced that by now.
And I'm like, all right. I'm not the worst.
Wait, has that
thing
ever
out there.
happened to you?
What?
Reverse crown seat?
I've never actually cemented a crown on backwards.
I have.
I've put it on backwards.
Yeah,
and
me
then,
too.
okay, yeah, no, but like he said he like
Left it. It's a pretty good fit. Yeah. It's just it's not open margins, just a shadow.
Yeah.
It's just the angle.
Well, to circle back to this endo gone wrong.
Yeah.
I sent it to
Endodontist.
Nathan. No, is it Nathan? What's the endodontist?
That's orthodontist.
That's orthodontist. Anyway,
Azari probably.
one of the
Apex.
endodontists that you normally referred to back then, and it came back 5 canals
Like on a number
on
12?
on a number 12. Like, well, I was never gonna finish this tooth.
Yeah.
Like, it was never gonna go right.
Well, you would have found one and called it.
Yeah, I would have been like, boom, that's the one.
Yeah, sometimes so if you don't, for our non-dentist listeners, what we're talking about is when we're doing a root canal, we stay in the middle of the root, and there's a little tunnel with blood supply and nerve supply. We're removing that tunnel and hollowing it out and then putting filling in it. When we're talking about perfing, is like we all of a sudden are not in the middle of the root anymore, and we go outside the root into the bone. And it happens to dentists, endodontists, almost every endodontist I've talked to, they've happened to them. And it's just some teeth are extremely difficult. So back to the 5 canals.
Yeah.
So sometimes I've been a dentist a little while, and I see x-rays like associate does, and I always don't know what to say when it's like a lower anterior or a premolar or even molar. And they're like, yeah, how's my root canal? I'm like, you missed the canal.
Yeah,
But you got it to the end, but you missed that one. I never know what to say because you don't want to like crush their confidence.
Yeah.
And you're like, you gotta put something in their note, like after final X-ray, notice the canal, informed patient. So it's always like how do you build confidence and do like the right thing, you know?
Right.
I've always struggled with it, especially on like a tooth that doesn't tip, like that tooth.
Yeah.
Like if you sent to me, you got 2 canals done, and I see like there's 3 others, I'd be like, oh, nice, dude.
Yeah.
He didn't see the other 3, you know, because I wouldn't have either. But you sometimes see it in the X-rays when it's not your root canal, you know.
Yeah,
so.
that's probably true. You get like maybe not X-ray fatigue, just tooth fatigue.
It looks
It was like,
great.
it looks great. I'm done with this thing. Wash my hands. I'm out.
Dude, endo can be the most frustrating thing for so many of us. And it's a weird one because I remember like 5 years. I always did root canals. I would be quick to refer if things were going wrong.
Yeah.
And it took like 5 or 6 years of doing them over and over where I suddenly felt like I sit down, I'll find all the canals, I'll get them to the end, and we'll move on. I'm not worried about ledging and it took that long. I mean, you're talking hundreds of root canals before you felt efficient, even close to an endodontist standard.
Yeah.
Well, I should take that back. Even close after an endodontist been out of school for a year. Because I think actually most dentists are better than a lot of first-year endodontists.
Yeah.
I do a lot of root canals, you know. We've referred to an endodontist who brought in like a new associate endodontist, and it's rough. Because they don't have that many under their belt.
Right. They were in a residency program where everyone in their program's trying to get root canals.
yeah, they're just trying their best.
Yeah.
And some things go wrong. But then you get a dentist, then an endodontist, because like a new grad, first root canal on your patient, it's scary. And then like 3 or 6 months later, it's like, oh, yeah, they're like
they
way
got
better
it.
than we are and way more efficient. And
Well, they
found
just get
all
that
canals.
repetition over and over and over
Yeah.
again. And their whole team, that's all they do.
So we had a training, 2 weeks ago or 3 weeks ago now with all of our dentists.
Yeah. Yeah,
And
down here in Arizona.
Dr. Perry came in and gave us some techniques that he uses to do root canals, and we kind of split them up because some dentists had quite a bit of experience, and some had won't do any root canals or very limited. I thought it was great. Did you guys like it?
Yeah, I think it worked out really great. I don't know why Dr. Perry's your friend. He's a really nice guy.
He's handsome.
Yeah, he's handsome.
Has
Good,
all his
great
hair.
hair.
Yeah, great skin.
Yeah, great. Really nice looking
He
guy.
looks like he's like 20, 30.
Yeah. I thought he'd be like your little brother or something.
Oh no, he's much more handsome, much more articulate.
Yeah.
He's like more appropriate with his jokes.
Yeah, that's right. I could appreciate
More
that.
professional.
More professional.
Yeah, 100%.
No, actually, he did a fantastic job, and I think it was a really good opportunity for our doctors to, just like you said, those that were like, starting from the beginning or very limited experience, we were able to focus on that, as well as get some of our doctors, doing perf repairs and apicos and doing some really hard, when there's no pulp and calcified canals and stuff. So
yeah, and because that's usually where. So two times they typically have a harder time with perforations, either the calcified teeth or if they have a previous restoration, like your patient had the crown. Because sometimes the tooth's turned, you have no idea because there's a new crown on it.
Right.
So you perf, and that's
we make the crown
common.
make it look great coming out of the gums, but below the gums.
Yeah, you don't know what's there.
Yeah.
You have a harder time, especially if you use a rubber dam and it's isolated.
Yeah.
That's why we'll do a split dam typically so I can see the teeth adjacent, and that gives me an idea of like, is the tooth turned or is it where it's supposed to be?
Yeah.
Anyways, that's cool. What else do you think your dentists have applied anything up in Washington? I've been talking to mine, so I have a little bit more of a...
Yeah, I think Dr. Buck and Dr. Fisher, I think they've been implementing some stuff a little more. I haven't talked to Dr. Smith much, and I think we're just trying to get the right case for Dr. McDonald so we can get in there and get started. But she seems motivated to do it. And so I think, if nothing else, just having the confidence to talk about endo.
Yeah,
now,
I think it's so powerful when you as a dentist can do it, and it's okay if you still refer it out.
Yeah.
But how greater of an experience for the patient knowing like, hey, you know your stuff and you send it to an endodontist versus just always sending out to the endodontist and having no idea what they do or
it's like a mystery.
Difficulty. Yeah, it's just like, they'll figure it out.
Yeah.
And it's like, well, probably you should figure it out and then have the endodontist do it if you're not able to do it or don't want to do it or what the case is.
Yeah.
I thought it was cool. I think he used, because I do pretty much what he did like 5 years ago. And I always forget to like update what he changed. And so it's fun to hear the updates that he's changed from his protocols to be either more efficient or have a better outcome. Yeah. So I thought it was great to hear that from him and the products he uses. And here we just kind of bought all the products, just a small sample of each and say, use them, try them out. If you don't like them, we won't order them again. Yeah. But try them out.
Yeah, I thought it was, it changed the way I do endo.
Does it?
Yeah.
In what way?
The crown down.
Oh, that's right. You were doing it like dental school way.
Yeah, I never.
That is so crazy.
Yeah. And man, endo's way better.
That is so bizarre.
Yeah.
Because I haven't done it that way for over 10 years.
Yeah, well, I've been doing it for the entire time.
Since 2018.
Yeah.
That's funny. So in dental school, there's a different technique for our non-dentist listeners where you're enlarging that tunnel.
Yeah.
And in dental school, they teach you to enlarge the top portion first, and you work all the way down till you get through the file or to the bottom of the tooth. Pretty much everyone stopped doing that years ago.
Pretty much everyone.
Yeah.
Not everyone, obviously.
But in dental school, they still teach it.
Yeah.
And so now they use a more conservative method. So we take away less tooth structure, and it's more efficient too. And so I was a little surprised that a couple of dentists said the same thing. Like, oh yeah, I didn't know we stopped doing crown down. I was like, what? That's it's pretty old, man.
Yeah.
It takes
Not
a long
all of us
time.
have an endodontist friend that they talk to.
It's true. Or, Dental Town or Facebook groups.
Yeah,
or,
whatever.
He's like, I'm still doing amalgam. There's this like white stuff called composite. You guys hear about this?
Actually, I had an endodontist when we first opened up in Spokane that I asked him because we'd had a couple patients complain about getting amalgam restorations in their crowns.
Oh yeah.
And I asked him, I was like, hey, can you like start doing composite for my patients? They're not happy with this. He's like, no, it's not as good.
It's not as good.
And it's like, please.
Well, you could tell them to like, because we've had this conversation.
Well, you put a liner down and then,
or do put a liner of amalgam.
Yeah.
And then this cavity on top.
Yeah.
And then they get their seal.
Yeah.
And then patients don't know.
Right.
And then you can still do the
Yeah, it was just funny. But the way he did it, he was just like,
Nah.
he's like, no, I'm not going to do that for you. And do you know why I'm not going to do it for you? Like, wanted to really give me a talking
Yeah.
to. He's an older endodontist. Well, he doesn't get our referrals anymore. So.
So I'm glad you're doing it right, and all the endodontists in the world do it a different way, just to like make the patient happy.
Yeah.
And I think most endodontists are very good at saying, hey, you have like 30 days to get a crown on this.
Yeah.
And so then you don't have to worry about the amalgam anymore.
Right.
Leakage. Well, it should be fixed with a nice fitting crown, but
Yeah.
that's funny.
Well, and I mean, with the liners and stuff too, you can seal it off pretty dang good.
Yeah.
It's not the same.
It's not as amalgam. It's not like
it's,
mercury leaking through the teeth.
Yeah. That's
Bacteria don't like it.
Yeah. Bacteria doesn't like mercury.
Doesn't like mercury or copper, zinc and palladium. What is that?
It's an amalgam of metals.
Amalgam and mercury. Why wouldn't it like it? But they do last forever, and by far the best restoration out there is amalgam and gold. But we are not allowed to do those anymore. I
Did
guess.
you do gold in school at all?
Yeah, I think I did a couple gold crowns in the very, very back. But no,
I'm talking like foil, like gold foil.
No,
like,
I'm not that old.
Well, we had a dentist in school that was teaching it to some students.
Probably like
it was like an extracurricular, like go learn to do gold foils.
I think we had one of those. The prosthodontist had like an after-school clinic about gold foils, and I was like, probably not ever going to do that.
Yeah, I mean, I believe it's a great technique, and patients don't want it.
No, they don't, and they're cool. I mean, they're better looking than amalgams because they're a gold or yellowy.
Yeah,
but they don't. It's not like a ugly yellow. But it blends in more than amalgam. Like if someone yawned, you wouldn't see gold inlays or onlays. You do see amalgam.
Yeah, you see the silver.
Yeah, and they usually last forever. Like I had a patient a few months ago I saw, and I was like, man, these things are going strong. She says, I got them back in college, and it was like 40 years ago.
1950.
I was like, I still remember it because I think they had some pneumatic hammer thing they used to use to like
that would make sense
drive
to
it in.
Yeah,
and I remember it was going. I was like, that's an old foil, man.
Yeah, it's
awesome.
actually funny. We get all of us dentists get these patients that are older, and they have this trauma stories, or at least conversations about when they were a kid in the dental chair. And I'm like, well, we don't do it like that anymore.
And then you just go and do the same thing. Do you ever think like sometimes I go, oh yeah, dentistry's changed so much better, and then you just go back and I'm like, nah,
that's probably isn't any better.
We might be a little more conservative, and our stuff looks better.
Yeah.
Like our porcelain crowns and our white fillings, and it's almost the same. We
just like to tell ourselves we're better.
Yeah, like our needles are so much smaller.
Yeah.
Nah,
I think maybe the difference is actually not a real difference. It just Hollywood has painted this picture that dentists used to just be grumpy, mean, old, and not care.
Yeah.
And so by me caring, I'm like, oh, I'm definitely better than all the dentists that were.
Yeah. No, I think it's been the team and the dentist mentality that's changed. Like we had a guy that used to do our TikTok videos for us, and he did TikTok videos for other businesses. And we had a conversation. I'm like, is it just like our feeds that we see like a lot of dentists? And he said, no, that's actually a lot of people see dentist feeds because they're fun, cute girls usually that have a lot of personality that enter the dental field.
Yeah.
And so that's usually like fun skits or whatever.
Yeah.
And people so not just we'd probably get more because we are dentists, and a lot of people see the dentist videos because they're usually funny.
Yeah. And there's a lot of fun in passing it around and laughing at that this is your dentist
but can you imagine, dude, my kidney doctor, the guy's the most dry like scientist mind. Like to see him have any personality, it would be like lethal.
It almost like I don't trust you anymore.
Yeah, like no, but like your medical professionals, like the doctors would not. And I some do TikToks obviously, but probably 80% of them do not. Whereas 80% dentists are willing to do something,
Yeah.
To entertain a team. Or
I think we have a lot of interaction with our patients where some other specialties are more like 5 minutes in and 5 minutes out.
Yeah, and they're required to because insurance reimbursements and stuff. And we get in that same mindset sometimes. We're just a mill. We're just trying to get people in and out.
Yeah.
And it's hard to have a personal touch. But I think if you stack the like dentists by dentists that have like more personality, more outgoing, more friendly to the team, Whereas doctors are kind of trained to be like, I know all, so I don't come
Yeah.
down to your level, kind of. And I think that might be changing a little bit. Maybe that's old school, but
Yeah.
just want to get
You
off
say
the
it
phones
sounds
with
like
doctors.
sounds like you hate like
No,
family
I
doc.
think that's just how they're trained. I think that's I think to be them, they're like the brightest people. They've never been told they're wrong. you
Yeah,
know? And
yeah. You have a
they
bad
are wrong.
interaction with a few doctors.
Dude, the orthopedic surgeons are like such morons, you know? Like, you gotta have this. I just had a conversation 2 weeks ago, and I usually don't. Yeah, I want my my patients to pre-medicate for that knee surgery she had 20 years ago. I'm like, well, why don't you guys prescribe?
Right.
Well, that's not our duty, is it? I'm like, it is.
If you want to go against current recommendations,
If you want to go against your own board.
is.
God, they're so funny. Like, okay, are they not allowed to brush their teeth either before antibiotics?
Yeah,
or
you
eat
got
potato
to.
chips?
I know
or-
it's such. Well, and I mean, with joints, maybe there's something out there.
Zero.
I was gonna
There's
say
no proof.
but I was recently reading something that's like less than 1% of like cardio involvement with bacteria and stuff like that. Has nothing to do with bacteria that lives in the mouth.
And if it did,
Like
it's not from-
endocarditis
it's
is
not from your cleaning.
no, it's not from your cleaning.
They have a study done where they brushed their teeth and it was just like getting their prophy done. So,
Yeah.
like I said, do you want the patients to take antibiotics before they brush their teeth every day? No, because it doesn't make any sense.
No, it doesn't
It's
make
silly.
sense.
Like I get maybe if you're doing a bunch of implants and
Yeah,
replacing
bigger stuff.
flaps, even then I don't get it. But anyways, we really sidetracked there. That was just a reason.
Well, do you do antibiotics after doing an implant?
Mm-mm.
No.
No, I don't do anything.
What about bone graft implants, stuff like that? No. What?
Not at all. Unless, when I do it, it's when I'm not confident.
Yeah.
Like, I think I got that infection out, and I'm second guessing. I'm like, that was a bad one. We got to put you on antibiotics, And
Yeah.
but no, I'm pretty much goes by the book from the oral surgeon, whatever place had a white what they call it, white paper about antibiotics. I'm pretty strict to following it because it's very there's a lot of evidence that does no good. So why are we doing it?
Why are we doing it? We're just wrecking their bio.
And and that's a new thing. And the patients don't take the full dose anyways.
They never do.
So it's like, I don't really. We'll save it for an infection down the road that works. And we still give it out for necrotic infections from time to time, but most of the time, no, I got it out.
Yeah.
We're good. Move on.
That's I tell most patients, I'm like, hey, we're gonna mechanically remove the infection, so we don't need to overdo it on antibiotics here.
Yeah. And I think more people are becoming more in tune with their GI tract, what they call the bio.
Yeah, your gut biome.
Your gut biome.
There
That was
you go.
close.
Yeah.
I think more and more of us are becoming more aware of how important it is.
Yeah.
And so I think more and more patients are okay not taking antibiotics, whereas 10, 12 years ago, it was like, well, do I get antibiotics?
Yeah, give me my antibiotics.
Yeah. And that was, I think, because dentists were also less skilled sometimes. And so they gave them antibiotics to kick them to the endodontist or oral surgeon for everything.
Yeah.
So, and now we're more doing more in the office.
I just say now seems like endodontists don't want us to put them on antibiotics.
Yeah, if there's like sometimes it will if it's a necrotic tooth.
Yeah.
And it's been hurting them, I will put them on them, or I'll tell them like, just take this like 2 or 3 days before you go see the endodontist, and it'll make your procedure easier to get numb and stuff. But besides that, I don't do it typically unless, like I said, unless I think I messed up or missed something. Or
you heard it here. If you're getting antibiotics, it's because he's
sure.
not sure about what he just did.
You ever have an implant come back and you did a second stage, so you bury the implant, you fully covered it up with your tissue. They come back, you see the tip of the implant. They're like, just barely the cover screw.
Yeah.
You're like, let's put you on antibiotics.
Yeah, just try it out.
Just
Let's see
try
if this works.
Or here's some chlorhexidine. Let's just rinse with that. Let me see in a week. They come back in a week. Of course, it's not any better.
Yeah, it's not any better, but we want to try.
More of the cover screws exposed. You're like, crap, what do I do here? Everything's fine.
Yeah.
There's no pain.
Yeah, they don't know that there's no bone around this implant.
It's just it happens, and I don't know what to do. What do you do?
Well, eventually I removed the implant.
No, but never doesn't always fail. So it will last like that for like 3 months for the when you go restore the implant.
Yeah.
And it just lost like a millimeter of bone.
Okay.
So like when it's brand new,
I'm thinking you're thinking like the implant's actually
sometimes you know it's coming. Well, sometimes you don't know. That's what I mean. Sometimes I've been surprised both ways. Where one, I looked in, I'm like, oh man, that doesn't look right. Let's try some mouthwash. Come back in a week. I'm like, okay, it looks okay. And then a week after, like, well, the implant came out. You're like, yeah, it didn't. And they come in, it's out. And other times you're like, that doesn't look very good. I'm sure that's going to come out. Let's see what happens. And then
And then
3
it just
months later,
heals
I'm like,
up.
you just lost a millimeter bone. Let's restore this thing.
We're good to go.
Yeah. Well, sorry, we went all over. We
Actually-
even have a theme that time.
Yeah,
the
we
podcast.
nerded out on dentistry hard.
We apologize for our non-dentist listeners.
Yeah, hey, like we're not nerdy dentists, and
We
we
are,
are nerdy dentists.
We are so nerdy. Look at us. We're doing podcasts. We have 3 different cameras pointing at us.
We do, and headphones.
We have light sources. We have headphones. We have
Hey, don't give away the light source. This is my natural glow.
roadcasters and Cassidy producing, editing all this.
Yeah, she's pretty
all
great.
for nothing.
Yeah.
Just for nerdy.
We're giving away all the secrets here.
It's all out
We
now.
naturally look this good. No one edits our video.
Well, we have like 18 or 17 others that were not edited.
Yeah, maybe we'll release those, the unedited
And
versions.
then I gotta like go listen to them. Anyways, well, that's good. That's a wrap. That's the show.
Yeah.
Now you know how to do root canals.
Yeah.
You know how to not prescribe antibiotics. And you know that
And-
it's gut
and-
biome.
And you know what to do if your implant cover screw starts exposing itself. Just wait it out.
I don't know. What do you guys do?
I wait it out.
Okay, yeah. I think most of us wait it out.
Yeah. I hope and pray way more than I like. Yeah, that implant's failing. Let's take it out.
It's so weird. Like the surgery all went well, and you're like, that's not right.
Yeah,
And you're just like, well, let's just rinse with some chlorhexidine.
that will fix it.
It does fix it.
Fixes everything.
Well, I'm glad you're back in town, Ryan. I'm
Yeah,
glad we're
thanks
together
for having
again.
me.
We'll be together again because we're probably going to stay here and do another one. Another Secrets Out. But we're going to make it happen. When in Rome, we're going to make it happen.
That's right.
We got to get ahead of ourselves because we have a few trips coming up. So,
Yeah. Well, thanks for joining us on the Dentist Show.
and make sure you subscribe. And she told me to say like 3 S's. Maybe it's 2 S's.
Subscribe.
Share. Oh yeah, that's what she said. So we don't make any profit from this.
Yeah.
And so if you just share to your friends, maybe we can get some like cooler guests. I mean,
Oh.
my wife's the best, and maybe some other guests that we want to hear. And
Yeah.
share
If you guys
from.
share it enough, Cassidy might come on.
Yeah.
She just needs a big enough following.
Yeah, and maybe we can get some of those dentists that I talk about, but I don't know their names.
Yeah. Well, I'm actually, spoiler alert, I'm hoping to meet Brady Smith.
Brady
Brady Smith.
or Brad Smith. That sounds like
Yeah.
this guy though.
Brady Smith this weekend, and I'm gonna try to get him to come on a podcast.
Yeah,
maybe.
see if his
If
head's
he's
sweaty from his
interesting.
wig.
Yeah,
you know?
that's the
That's the real
the
one.
main question is to find out if his head's sweaty from his wig.
Yeah.
Because if it's not, Chase is gonna get a wig.
Yes, you're gonna see it on Spotify or YouTube here soon.
Yeah. And then maybe we can convince the guy to join on a podcast.
That'll be funny. He's a funny guy.
Okay.
Well, thank you. Thanks for joining, guys.
Yeah.
Thanks for listening to The Dentist Show. We hope that this episode helped you make smiles about more than teeth. To get more resources to grow as a dentist and to learn more about Chase and Ryan, go to thedentistshow.com or just follow the link in the show notes. If you enjoyed this episode, share with another dentist in your life and help us grow the movement. And be sure to rate and review wherever you're listening.